Hello, movers. Welcome to Move Daily Talks. I'm your host, Tracy Steen. Well, what we're talking about today has everything to do with what's going on in the head, in your ears, your nose, your throat. And today's guest is Dr. Jessica Lee. She is an ENT, so the perfect person to ask all of our pressing questions to. Dr. Lee is a double board certified otolaryngologist, which is a head and neck surgeon, as well as a lifestyle medicine physician. She specializes in integrative approaches to chronic airway and sinus disease. As the founder of Integrative ENT Health, she combines conventional ENT care with evidence-based lifestyle and integrative therapies to help patients with chronic inflammatory conditions optimize both symptoms and long-term health. Again, another healthcare practitioner who really looks at the whole picture. And you know what is kind of neat about this guest? I asked her and she was like, oh my goodness, I follow you. My sister and I follow your workouts all of the time. So I didn't know that. So she knows me. I don't know her yet, but I can't wait to get to know her. Let's welcome Dr. Jessica to the podcast. Dr. Jessica Lee, welcome to our podcast here today. Thanks for joining me.
Thank you so much for having me, Tracy. I'm excited to be here.
I was just telling the audience that when I reached out to you, you're like, actually, I know you already. I follow your workouts, which I was like, oh my goodness, that is amazing. So thank you for moving daily with me.
Oh my gosh. Look, you were like my savior during the pandemic. My sister and I
That long.
were faithful followers. Oh yeah, yeah. Because your workouts are great, and they're wonderful, and you can get them on YouTube and all these great things.
Yeah, I know. Convenience at your fingertips. That's awesome. Well, the reason, folks, why I had Dr. Jessica on is because I myself have struggled with different symptoms from the neck up, so like things like dry eyelids, sinus issues like drippy nose syndrome. That's what I call it. It's probably not called that.
That's a good one.
Pulsatile tinnitus. I feel like I've kind of gone the gambit of all of the different things that can occur in perimenopause, menopause, and beyond. And so that's why I wanted you to come on, clear up some confusion, maybe just give us some insight as to why these things are happening. And then, of course, what can we do to alleviate some of the symptoms, because they can be very annoying. And we'll start with one that I find so annoying is the nasal drip. And I'll tell you, probably, I want to say maybe 7 years ago is when it started. So that would have been, I would have been, 48. So perimenopause. And all of a sudden, my one side started to drip, drip, drip. And I was actually training an ophthalmologist at the time. And he said, you better go get that checked just in case there's a polyp in there or something that's causing that. So I made an appointment. A year later, I got to see the ENT because that's how long it takes in Canada. But there was nothing in there. I had broken my nose as a child and had, he said, a bit of a deviated septum, like they didn't fix internally that well. But anyway, he's like, it shouldn't be causing that. There's no problems. Anyway, but still drip, 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 drip. And yeah, it's very annoying. So why do we develop these sorts of things, especially nasal drip in menopause?
So, quick science lesson to start, right?
Good.
People talk about estrogen with perimenopause and fluctuations, and then decreased estrogen postmenopause. But you have estrogen receptors in everywhere in your body, including your nose. And obviously, progesterone, we talk about too. But the main thing here is that when you have those wild fluctuations or withdrawal of estrogen once you're postmenopause, the tissue in your nose changes, just like you're experiencing the skin changes. People talk about dryness of the skin, loss of elasticity. You're going to have a similar problem in the nose. In the nose, the way it manifests is thinning and drying and decreased mucus gland production. And that has to do with estrogen's indirect effect on a neurotransmitter called acetylcholine. And acetylcholine is a chemical transmitter that helps blood vessels dilate, which again increases blood flow to places, helps with fluid kind of moisturization of the tissues. And so when you lack that, you get drying, you get thinning. But paradoxically, you were like, but it's dripping all the time. Why is it dripping all the time? So paradoxically, there's watery glands and there's more gel glands. And you get less stimulation of the gel type glands, but you have still persistent watery glands. And so you start just getting that that tip drip, I mean, you are right on the nail because I was in the car a few months ago with a friend and she was like, what is this menopause tip drip I'm having? Tell me about this. And I was like, that's a great way to describe it.
Yeah, I
But
haven't
yeah,
heard
so
of
that's
that, but I
kind
will
of
call
the
it that now.
yeah, menopause
Hip
tip
drip.
drip. We're going to start
Gross.
that.
Yeah.
But yeah, so it all
Okay.
comes back to, the effect of estrogen on that tissue.
Yeah. Amazing. I just spoke to you and told you that I had Dr. Bill on, or Dr. Will Bulchowitz. Is that how you pronounce his last name? I just called him Dr. B.
So it's,
He's
yeah.
Bulchowitz. Anyway, he was talking about how much estrogen receptors are in the gut, even. They are just everywhere. So, of course, it stands to reason that as we move through perimenopause and menopause and beyond, we lose estrogen. Every area has the potential to be impacted. It doesn't impact some more than others. Why is that even? Like, why do some people sail through and other people get certain symptoms? Is there other factors that can contribute to something like a drippy nose syndrome?
Sure. I mean, you've got to also factor in any underlying pre-existing inflammatory conditions, right? If someone's had a nasal surgery and they've had, this is not something we do anymore, but in the old days, they would resect entire turbinates, which the turbinate is kind of like a filter in the nose. And that's where you have a lot of these mucus glands that help hydrate and moisturize the nose. So if you've already gone through a surgery like that, and then you go through perimenopause, it's like you have a double whammy. So that's one example.
Mm-hmm.
Another example would be someone who suffers from allergic rhinitis, and maybe they are well controlled because they use a lot of antihistamines. Well, antihistamines can also be drying. And then so you add to that estrogen withdrawal. And again, it's like a double whammy.
Mm-hmm. Okay, so estrogen receptors are shifting. They're basically non-existent. And so we can get symptoms like the drippy nose. What can be done about it? Is that something that we have to live with, or is that something that we can get a medication or anything to help prevent?
The way I approach it is the nose is one piece, and I'm by no means a hormone specialist. I don't prescribe hormone replacement therapy, but I've educated myself enough to be able to have conversations with my parents, with my patients, and be able to talk through, are you on replacement therapy? Have you thought about it? What are your other symptoms? Where are you in this process? There's not studies yet that show hormone replacement therapy is going to fix the problem. But
Okay.
the point I always bring up is we have to be talking about it, because until it's more widely recognized as part of this bigger picture of perimenopause, there will be no one who recognizes it as something to do studies on.
Right.
So, I like to have the big conversation, and we always focus in on basics. I also, in addition to my ENT training, have the lifestyle medicine training. So I like to talk about nutrition and physical activity and stress management and sleep. And all of that ties in very tightly to perimenopause care.
Of course.
So I don't want to neglect bringing those things up. Now, specifically for menopause tip drip, it is going to be a discussion of which version are you. I tend to see women who are either like very dry and irritated and congested, but they don't have the same drippiness. And that's going to be a different profile than someone who has just that excessive drip. There are pharmaceutical medications that we can do. There are actually some procedures that are now FDA approved that can be done in the office. But I like to start with just moisturizing tips. And we talk through saline rinsing, we talk through saline gel. There are oil-based nasal sprays that can be really lubricating and just give people that sense of relief.
Okay. Okay. And that's something I haven't tried. So that's a good place to start, is what you're saying. And then if it persists
Yeah.
and it's so irritating to you, see your physician and see if there's
Right.
another treatment that you can come up with. As you were talking about the estrogen receptors in the nose, and how there hasn't been a lot of studies yet on, if menopause hormone therapy would help that. What just went through my brain is that, okay, vaginal estrogen, of course, is now prescribed like readily and recommended for almost every woman for the what is it? Genitourinary
Genital.
syndrome of menopause,
Perfect.
right?
Yeah,
Which is basically all of the action down below, girls. Like,
that's right.
bladder infections, UTIs, so on and so forth. And how much that cream, estrogen cream, basically can enhance the lining of the uterus, of the cervix, and really make it plump again. Would the same thing work inside the nasal passage? Like, have they done any testing with that?
Well, I'm so glad you asked because
Oh,
there's actually a study that was done several years ago, and I'm going to talk through the study and then we'll talk about why it's not
okay.
recommended more. So
Okay.
the study looked at topical estrogen. So a lot of women will use topical estrogen like on their forearm or their thigh for the systemic effects. And they took women and they sort of randomized them to either get the topical traditional treatment or they were going to get a nasal spray version. And then
Oh,
they had their control group. And
okay.
these women were also having a lot of nasal symptoms, congestion, runny nose, sometimes burning symptoms. And the cohort that was on the nasal estrogen spray had the same benefit in their systemic symptoms, but improved benefits from specifically the nasal symptoms. And I
Oh,
remember reading this and being like, why don't we have this available?
right.
Well, it's not, there's nothing approved in the US. That's the honest answer for
Okay.
this. You can get it compounded. Of course, you always want to talk to your clinicians and use caution using compounding pharmacies. And a key difference between vaginal estrogen and nasal estrogen is that nasal estrogen is systemically absorbed. So,
Right.
again, as an ENT, I don't feel comfortable just putting people on nasal estrogen for isolated nasal symptoms because
Sure.
it's going to influence the rest of their body. That's
Okay.
not the case with vaginal estrogen. It's going to stay in the vagina.
Right. Yes, exactly. Okay, that makes a lot of sense. Well, I'm sure more studies will come out regarding that and to see if it can be a twofer because that would be great if it could help that area as well. So nasal passages and maybe our throat can lead to things like snoring. I'm sure there are women, I don't feel like I snore. No one has said that I snore, so I feel like I'm pretty clear of that. But of course, snoring could lead to things like sleep apnea, which can be very dangerous for our health. So, can we talk about, is it something that you see a lot of in women? If that is the case, what is your recommendation for those of us who have snoring issues?
I think the important thing to remember is that snoring is a symptom and it can be a signal that there's something more serious going on. So if any women go from not previously snoring to snoring, you absolutely want to see your medical team and have somebody take a look.
Yeah.
With the perimenopausal change, what's happening with the estrogen fluctuations and then the withdrawal is you are getting not only the decreased elasticity of the tissue, right? So you get that the decrease in collagen cross-linking. So you've got kind of softening and relaxation of the soft tissues. And that's going to impact your throat significantly because we don't have a bony framework that supports our throat. It's all soft tissue and it's collapsible. So you get more collapsibility of the airway. You also get, again, drying of the tissues, which decreases that lubrication. You can actually get, in some cases, increased like truncal and neck fat deposition. As we go through menopause, where we carry our fat changes
Yeah.
as women. In fact, it's so interesting with obstructive sleep apnea in particular, and I'll come back to primary snoring, but it is absolutely hormonal related because in adolescence, we know that the prevalence of sleep apnea in boys versus girls is equal. And
It,
then
sorry, what did you
at
say? In boys versus girls is what?
the prevalence is equal. So it's a 1-to-1, boys are just as likely as girls
Okay.
and kids and adolescents to have sleep apnea.
Okay.
When we go after puberty, men actually are more likely to have obstructive sleep apnea.
Hmm.
But when that prevalence comes back and matches women again, is postmenopause. So it gets
Interesting.
more common as women get older.
Right. So what are we
Yeah.
doing about that if we have that?
Yeah. So again, thinking about decreased tissue elasticity, there are certainly, ways to improve that muscular tone through just basic, again, physical movement, activity, strengthening. You also want to think about, weight management playing a role if there
Mhm.
is concern for weight gain that, can be discussed and worked on with a primary care team. But again, what's interesting is that as we're starting to look at these questions in women specifically, there was a study that showed that women who were on HRT, I guess let me reverse that. Women who were not on HRT going through peri and postmenopause were 4 times more likely to have obstructive sleep apnea compared to their premenopausal counterparts and their peer counterparts in postmenopause but who were on HRT.
Right.
So
Huh.
again, not a causative study, but there's a signal showing up, and that's always cause for a second look.
Oh,
I
for
think the other
sure.
big thing with women is that it doesn't present the same way. Sleep apnea doesn't present the same way as it does in men. And so, women will often complain of, well, let's be honest, women actually don't complain. Women don't go see their doctor as much
Big
for sleep
deal.
issues as
Yeah.
men do. But when they do come in, their concerns are fatigue, mood disturbance, headache, brain fog, right? Men are going to be snoring, gasping, apneic pauses witnessed by a partner where they stop breathing temporarily.
Right.
So there's already a problem with missed diagnoses in women. And so I think that's important to keep in mind too.
Yeah, for sure. Absolutely. Before I came on this podcast, as I do with every podcast that I go on before, I'm like, get get it all out, clearing my throat, swallowing and feeling like there's maybe a little bit of a lump in my throat. I shared this with a friend. She actually said, I had a crazy experience with that. She's like, all of a sudden, it was like it developed kind of overnight. I thought I had something stuck in my throat. It was so like every time I swallowed, it was like a big lump there almost. And she had said that she heard that it was, due to something in menopause as well. So I didn't ever think it was related. But what is that about? Lumps in the throat, clearing the throat. Is it like sometimes I feel like it's right after my Greek yogurt? Is it from eating dairy? Is it from, my postnasal drip? Like, what is it from and how can we stop it?
Yeah, again, God, you like to choose like my favorite things to talk about. So a lot of people, will have these types of symptoms. And like you said, a lot of people assume it's allergies and they'll go to the doctor and they'll get put on allergy medications. And honestly, most people don't really get much better. And so the question is obviously, first and foremost, let's make sure there's not actually something there. We can do what's called a laryngoscopy in the clinic. So you don't need anesthesia for this. It's a camera exam of the throat, including all the way down to the vocal cords. It's very easy, very quick to do. And so that is a good way to start because you do want to make sure it's not something else. I definitely have had patients who were told things were reflux and it was not, and it was something more serious. But let's say someone goes through and has that normal exam. Again, take what we talked about in the nose and apply it to the throat. You've got drying of the tissues, you've got decreased lubrication. You may have some people who are more mucus predominant, where it's like stickier. And then you may have some people who have a more watery type, where it feels like it's dripping and it kind of sets them off into coughing fit. And so that often brings up a discussion of something called laryngopharyngeal reflux, which is a type of reflux that impacts the throat. And it's typically not going to be acidic like your classic heartburn and indigestion type symptoms. That type of reflux responds really, really well to nutritional modifications. And we can go into that more, but it's not just what you eat, it's how you eat. Also, alginate therapies, things like diaphragmatic breathing, which helps strengthen the tone around that lower sphincter. And so for a lot of people, and again, to wrap back in the estrogen cycle here, when you have drop off of estrogen, you often have relaxation of your lower esophageal sphincter. So you're more likely to develop reflux. So it all kind of starts tying in together. There are obviously other possible reasons for throat clearing. There's something called irritable larynx syndrome, where it's more like a nerve hypersensitivity. But that's where, getting in clinic and kind of dissecting those apart can be helpful.
Let's, you mentioned some nutritional modifications, not just what you eat, but how you eat. I'd love for you to talk about both of those elements.
So I'm going to start with how you eat, because I think that for these types of symptoms, it is actually the much more important discussion. And again, fellow sufferer here. And my problem is in a busy clinic, we see upwards of 36, 40 patients a day. And I like to talk about things with my patients, which means I often don't really have time to eat lunch. Or if I do, I am woofing it down in 5 minutes. And I went through several months, I mean, maybe even years, where I just would go back to clinic and I would just be like, like all day, all afternoon. And I finally started saying, I can't do that. I've got to eat a smaller meal. I've got to slow myself down. And if I have time, I go for a walk. So, I mean, those are big ones. It's slower eating, right? Allowing time for that literal movement of the food to make it down to the stomach, allowing time for the stomach to start that digestion process. Smaller meals so you don't over distend the stomach. Again, if you already have something like a hiatal hernia, which is where part of the stomach kind of pouches up into the chest cavity and it expands that lower sphincter. So the lower sphincter can't close all the way. And they're pretty common. But that now puts you at an increased risk if you over distend your stomach of having things, escape back up into the esophagus. How quickly you're eating, how much you're eating in one sitting, and then trying to go for a walk after meals is really helpful because that movement does stimulate gastric motility, in addition to lots of other benefits. I think
Yeah.
the other one that's big, the other one that's big that I bring up is not eating too close to bedtime. And
Yeah.
it's always funny because, and I think you even mentioned dairy too, because I often have people come into clinic and we'll go through all these things and they'll be like, no, 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 I eat dinner at 6 o'clock and I go to bed at about 9 or 9:30. And I'm like, okay, but do you snack before you go to bed? And maybe the husband gets quiet or the wife gets quiet, and the other person in the room is like, you need to tell her. And they're like, well, I do have that bowl of ice cream every night before bed. And I have to laugh and be like, well, first of all, let's take out the bedtime snack, but also dairy is probably the worst thing you could eat as a bedtime snack.
Mm.
Um, so, those are kind of the discussions I have around
Yeah.
how people eat. I even had a guy in clinic today and we had this discussion and I finished this part of the talk and I kind of paused to see if he had any questions. And he immediately was like, yeah, I feel like you're in my house. He was like, that is exactly me. He's like, I eat too much, I eat too fast. I fill myself every meal. I don't, I always tell people like,
Yeah.
don't fill yourself to 100% capacity, eat
Yeah.
to like 90% capacity. So that's huge.
Yeah, some really simple tips and strategies to begin to incorporate. What I love about some of these things, and again, I told you that I had just interviewed Dr. B earlier, but there's so much crossover with how our current habits, behaviors can impact all aspects of our life. So we're here talking about, Dr. Lee and I are talking about how it impacts, your throat, your swallowing, and she says go for a walk after your meal, but that can also greatly impact glucose regulation and stimulate those that glucose sink in those big muscles and improve gut health, as Dr. B said. So I just love how it's some of these simple things. And sometimes when you're following really good healthy habits, you feel good in life. Like you're like, life is good, I feel good. And then if you're not doing those things, and that just seems like so much can go wrong, and so many things feel like crap in our bodies, and my throat, and my nose is dripping, and this and that. So it's just interesting that so many of our lifestyle habits can really influence how we feel.
Yeah. And it's great because, I can give someone, quote unquote, a prescription to take a 15-minute walk after their meals
Yeah.
or something like that. And it has so many other positive benefits
Yeah.
versus what unfortunately I see happen is people leave the hospital or leave the clinic with a prescription for, a PPI and no discussion around this. And then not only are they not getting better, but now they've got side effects from the medication.
All right.
And that's what's frustrating, right? Is there's so much more we can do.
I know, but sometimes we just want whatever is quick and simple, not whatever is consistent and, persistent. Like sometimes it's just hard to do the actual things that are going to lead to better health and feeling better. But we have to make a decision, right? We have to just say, what do I want in life? Do I actually want to feel better for the long haul and improve everything overall, or keep putting a band-aid on certain things? Yeah,
Yeah.
that's good.
And I truly think that patients do want to feel better and patients don't want to take medication. That's
Yeah.
something I have seen time and time again is, they want to know these things, they want to try. And, if it doesn't work, we've got backup options. We can go to pharmaceuticals, we can go to surgery if we need to. But most people I see are interested and they're willing.
As I'm sitting here right now, I hear my brain whooshing. I have what's called pulsatile tinnitus, which I learned probably about 4 years ago. I had maybe the first onset and freaked out, didn't know what it was. It's basically, there's actually a Facebook group called the Whooshers, because that's what it sounds like a whooshing, whooshing.
Yeah.
Anyway, I went down a rabbit hole to try and figure out what was going on. But I also went to the doctor and had everything done because I was freaked out. I had a brain tumor, or I was going to have an aneurysm, or something was happening. So I did have a CT scan and the whole gambit. But what is tinnitus. So there's a large variety of different types of tinnitus. Can you talk to us about some of those? Should we be concerned? When should we be concerned? Or how do we manage this?
So I'm gonna say tinnitus. I honestly think
Okay,
it's a
sorry.
potato, thing.
Good.
But so tinnitus is first and foremost, it is a brain problem. And people always look at me funny when I say that, but
Okay,
people think tinnitus ear. But in
right.
actual fact, tinnitus is produced by your brain. It is often a response to hearing loss or hearing damage of some kind. But by separating that out, I think it helps people understand when we talk more about the treatment options. It
Mhm.
helps people understand why we say those things versus, giving you an eardrop or something.
Right.
So if tinnitus, we know tinnitus is linked to hearing loss in many cases, but that is typically for most people a non-bothersome type of sensation. It's a noise that you hear, but that
Mhm.
I can't hear if you have it, right? And there's no diagnostic test for it. So it is a subjective symptom. And it is, again, mostly non bothersome for most people. There are a small percentage of patients where it becomes extremely bothersome. And there are treatments available. But for the most part, the discussions around your typical bilateral non pulsatile tinnitus is going to focus on distraction therapies, cognitive behavioral therapy to reduce how much it bothers you or how much you think about it, and sound therapies, or in a case where someone does have hearing loss, hearing amplification with hearing aids can be helpful. So that's kind of one bucket of tinnitus, and that's a lot of what we see. Unfortunately, there's not a cure. And I always joke with my patients that if I do find the cure, they won't see me again because I'll be a gazillionaire,
Yeah,
but I'll
no
share it with
kidding.
everybody because so
That's
many
right.
people have it.
Oh,
Now, the type you described, this pulsatile tinnitus, this is something that raises a little bit more of a flag. If I have a patient come in and they have a new onset, especially unilateral or one-sided pulsating type of noise, and I'll often say, does it seem to match your heartbeat? And they'll say,
it
yes,
does. Yeah.
yes. That is going to be primarily a cardiovascular related etiology.
Right.
And so I'll tell you a story. This was 10 years ago when I started at the practice I'm with right now. I met a woman, she was 58, and she came in with about a 2-month history of unilateral pulsating tinnitus. And I looked in her ear exam was fairly unremarkable. But again, anytime we have this, you can take a stethoscope, you can actually put your stethoscope behind the person's ear, and sometimes you can hear it too. And it's because you're hearing the blood flow next to
Right.
the ear. Now, the question is, why can you all of a sudden hear it? Well, that's where we have to look for reasons for the blood flow to be more turbulent and therefore to be louder. And so in this case, we got some imaging with her, and she did have evidence of a previous blood clot in one of the large veins on the side of her brain, which led to a workup. We did some lab work, and she had an elevated white blood cell count. And we looked back over her previous labs, and it had kind of always been elevated, but she wasn't actively sick. So that's usually white blood cells. We think infection, but she wasn't sick. Dots down the road sent her to a hematology oncologist, and she was actually diagnosed with a form of leukemia,
Oh, wow.
which is crazy. And
Yeah.
that story stuck with me, and she's doing great. It's thankfully a form that is fairly indolent. She got the area around the brain treated. She actually had a neuro IR procedure and doesn't have the pulsatile tinnitus anymore. So, that's a lesson. It's not to say everybody needs to be worried that they have cancer. That's not what I mean. But
Yeah.
the point is that is cause for a workup,
Right.
and to look at things like, head imaging to determine, is there some type of abnormal connection between blood vessels? Is there some type of clot? Or especially back to our discussions around, women and the cycle of life they're in, iron deficiency anemia is a huge reason for
Yeah.
pulsatile tinnitus.
Yeah, and I had that.
There you go. Yeah. I think there's like a 4 times increased risk. Women with iron deficiency anemia, especially as we get older, are 4 times more likely to have pulsatile tinnitus. So, and that's something that's treatable.
Yeah. Well, that is the thing. It is, just for so long, I don't know why, but my doctor didn't prescribe an infusion for iron infusion. Finally, I was just feeling so bad, and the iron pills were just making me constipated. So I was constantly
Mhm.
not taking them, or then it would make my butt bleed, and then I was losing more blood. And I was like, I didn't, sorry, folks, again, TMI, but that's what this podcast is about. But
Right.
anyway, eventually he did prescribe. I'm like, I need an infusion. I had seen them on TikTok and people, I'm like, I don't care what I have to pay for it. But anyway, because my ferritin was at 4, he's like, okay, yeah, we'll get this. And it went up to 69, I think, and progressively started to feel better. So yeah, that's interesting. I didn't realize the correlation between the two things, but personally, I
Did
did
you
have.
notice, did you notice a change in your tinnitus after the
No, I
infusion?
didn't.
No.
I didn't. But
Yeah.
now, like you learn to live with it too, right?
Mhm.
I've heard that a lot of people will do like even CBT
Mhm.
just for it because you're so absorbed by the sound. I can tilt my neck down and I hear it way less when I'm just sitting
Mhm.
normal. But when I'm working out, my heart's beating fast, it'll be whooshing, quite loudly. But there's moments where I hear nothing. When I don't think about it, I often don't hear it. But
Yeah.
because maybe if I'm nervous on a podcast, my heart beats a little bit faster, so I hear it and it's loud. But I did have all of everything done. Like I was freaked out
Mhm.
about it, right? So I
Mhm.
had echocardiogram, imaging on my heart. I had the CAT scan with the fluid that goes through the arteries and what's it
Yeah, like
called?
a CTA, like an
Yeah.
angiogram.
So,
Mhm.
right. So the whole thing and everything looked good. So then he's
Yeah.
like, the best thing, keep exercising. I'm like, all right, well, I'll do that.
You're like, do you know who you're talking to?
Yeah. Do you know who you're
Um,
talking to? It's like someone asked me the other day if I needed help putting my suitcase in the overhead bin. I'm like, I lift weights for a living. Hello.
you're like, this is my thing.
I'll help
Yeah.
you though.
Right.
Anyway,
Yeah, I
no,
mean, the other interesting thing about, and I'm glad to hear that it's moved into a place for you that is again kind of non-bothersome.
yeah,
It's there, and that is something that is hard. It's hard to accept, but I think that for a lot of people, again, describing it more as a brain signal, and so I'll often talk about what makes brain activity more chaotic or what amplifies brain activity. So we talk about, do you have coexisting ADHD or migraines, or we'll talk about how much sleep are you getting, right? Because that can make your brain maybe not recover as well. All those, what's the impact of caffeine and alcohol? And so you can kind of tease apart things and people
sure.
will make tiny adjustments. I remember I had a woman who was she was going back and going to law school in her 40s, and she was drinking like 6 cups of coffee every morning studying for the bar exam, and her tinnitus was just going crazy.
I
And
bet.
so sure enough, she's like, well, I have to get through the exam. And I was like, that's fine, but afterward, let's scale back. And sure enough, she scaled back and the tinnitus fell away again.
Yeah, maybe I should consider the caffeine. Yeah, because I have heard that it makes it worse. But you can drink decaf too, right? I mean, there's a little bit of
Yeah,
caffeine in that, but that might be an option.
I'm not evil. I'm not going to tell people they have to give up coffee completely.
No, of course not. That is my favorite thing. I wake up at 4 a.m. and it's like, oh, my dream, my boyfriend, I love you. Let's talk about dry mouth. I don't know if I haven't seen it lately, but it was trending getting mouth tape, keeping your mouth closed when you're
Mhm.
when you're sleeping. What causes dry mouth? I guess a lot of it is that we sleep with our mouth open, but even during the daytime, a lot of people can have a dry mouth, dry throat syndrome. So, what causes that? What can be done to help prevent some of those symptoms?
This is probably going to shock some people, but the number one reason for dry mouth, for true xerostomia, which is the code or the name for dry mouth, is what we call polypharmacy, meaning there are many medications that people take that have side effects of dry mouth.
Uh,
And it may not be one that does it, it may not be two, but when you start
okay.
stacking that side effect, all of a sudden you have this chronic dry mouth problem. And so the first thing I always tell people to do is take your medication list to your doctor's visit and have them go through every single one with you. And if it has a side effect of dry mouth, see if there's a substitute or an alternative, or
Okay.
maybe you don't need it anymore. So that's
Right.
always the first thing to check.
Oh, yeah.
You
Yeah.
mentioned mouth breathing and taping, and
Yeah.
absolutely. I mean, our nose is a humidifier, and we are meant to be nasal breathers. And so, people who, for one reason or another, which is like a whole nother podcast discussion, if people are mouth breathers, they are going to have a drier mucosa from not only the mouth, but all the way down into the throat, even into the lungs. And the other thing that does is it can change the oral microbiome. You mentioned you just were talking to Dr. B, and he's a good friend of mine, and we have lots of discussions about the
Mhm.
microbiome together. But it does, it changes your oral microbiome. They actually did do some studies looking at women who were post-menopause, and there was changes in the bacterial families that they found, but really what was more significant is there was an increased risk of candida overgrowth in postmenopause. And
Oh.
so that's fungus that, people talk about thrush. And so you may not have the full white coating on your tongue type of thrush, but if someone comes in and they're having that kind of dry cotton mouth, maybe burning sensation, there's something called burning mouth syndrome.
Hmm.
And while BMS or burning mouth syndrome is multifactorial and there's not often one thing, but I always check for fungal overgrowth. And we always think about that as part of the process. So again, it comes back to if you're a mouth breather, we got to look at that and we got to address that. But
Mhm.
we've got to look at your hydration. There's sprays and rinses and gums and things that can help improve salivary flow. We talked about the change in the mucus glands in the nose going through menopause, but that affects your salivary glands too. So you can have a decreased amount of saliva that's flowing to kind of contribute to that.
Isn't so much of mouth breathing because we can't breathe through our nose. Like I feel like I have that in the morning for sure. And even at night when I lie down, it's like it takes, I want to say a good 10 minutes for my nose to really clear so both passages are open. And then if I lie on one side in the middle of the night, I'll wake up and that side will be full. Like even if I
Mm-hmm.
don't have a cold or I'm not sick or anything, and then I have to lie on my back to clear it again. So it can make breathing through your mouth a lot easier, and you want to do it because you can't breathe through your nose. So what about the nasal strips, or what can be done about, again, just having, I guess, a nose you can't breathe through?
Again, please get it checked out. Like that's not normal. You shouldn't have to live that way because it's not
Right,
fun.
right.
Um, you know, Again, I think everybody deserves a good nasal exam, and I think everybody deserves to work with a clinical team who sees it from all angles. So I'm lucky that in Charleston, I am able to collaborate with a lot of dentists and dental specialists to, pay attention to not just is the nose open or closed, but also what's the shape of the nose in relation to the shape of the oral cavity. How are the teeth fitting together? Where is the tongue, resting? And then I'm also pulling in, when we talk about nasal exams, I'll often tell people you've got your structural part because most people come in and they go, oh, I must have a deviated septum. And I'll look and I'll be like, I mean, it's really not that bad. So there's a structural component and then there's the functional component. And that's where we want to make sure that, do you have allergies that are being untreated? I've had people who've had significant mold exposures in their home who just cannot breathe through their nose. Nutritional sensitivities play a role. Chemicals and irritants in the environment. I mean, I get down to the nitty gritty. Like I'm asking them, what kind of detergent do you wash your sheets in? Because
Okay.
even switching out to, hypoallergenic, non fragrance things, if you're lying in those sheets for 8 hours and you are sensitive to that chemical, it's going to
Ugh.
impact you by the time you wake up in the morning.
Yeah, for sure. I know I just actually watched that documentary on the plastics. I can't remember the full title of it, but
Yeah.
just, about the chemicals that are in fabric and clothing and everything else. Yes, the environmental impact and
Mm-hmm.
toxins can have a big impact on our ear, nose, and throat as well. Hey.
Absolutely. Yeah. I haven't watched that yet, but I've heard a lot about it. A lot of
Yeah.
chatter.
Yeah. A lot of chatter. Yeah. I don't know how, I always watch those. Oftentimes a documentary has someone in their pocket, you know, for the documentary. So you have to watch it
Right.
with some open eyes,
That's
but
right. That's
it's
right.
interesting anyway, for sure. Tonsil stones, bad breath, chronic congestion. We just talked about congestion, but I have actually had a tonsil stone. They're disgusting. And I don't know if you know what those are, folks listening, but it's a little like white rocky thing in the back of your throat that gets, I'm guessing, accumulated food over time. And then it just creates a little tiny stone. And then sometimes you're like, oh, I feel something. And then you cough it out and you're like, ugh. And
Hmm.
why do we get those? How do we avoid those, or
Yeah.
can we?
Okay. And then be honest, when you cough it out, do you then sniff it?
Of course you do. And it smells so bad.
And
It's
it's
so,
so bad. Why do
it's
we
so
do that
bad.
though?
I don't
Why are
know.
we like, let's sniff this thing?
You
No,
it's a
is there
foreign
a
object
Facebook
in your
group?
body.
Is
It's
there a
horrible.
Facebook group for tonsil stone people? Because there should be if there's not.
Oh my goodness.
Because you know, if you have tonsil stones, you know what we're talking about. Yeah, tonsil stones. Oh, okay. So here's the deal. Tonsils, when you are young, are very active parts of your immune system, and they play a really important role. But they kind of are done with that role by the time you're about a teenager, and they actually will start to shrink away. So I describe it like a grape that shrivels down into a raisin. And in some cases, it shrivels away. You can barely see it, by the time people are in 80s and 90s. So you've now got this little shriveled up tissue
Okay.
that has grooves and pockets and sometimes little holes. And so when we're eating, when we're swallowing and we're chewing and all this stuff, the saliva is mixing in, you can get little pieces of food debris that get stuck in those little crevices. Then the next decision as to will you get a tonsil stone or not really has more to do with your microbiome. So if
Oh,
you have a predominance of bacteria that produce a gas, like a sulfur gas, and we think of sulfur as like farts that stink, right?
yeah.
But if you have those type of bacteria predominant in your mouth, it is going to start to not only metabolize that food, but coat it, and it'll kind of crystallize in a way. But it's also giving off that gas, and so that's where that bad, really rotten smell comes from, that rotten egg kind of smell.
Yeah. Okay.
So, we've got size and shape of tonsil, we've got microbiome, and then you start adding in things like, do you mouth breathe? Again, drying out can make this worse. Do you have allergies, which, don't just impact your nose, they impact your mouth and your throat too. And so that's increased levels of inflammation contributing. Reflux, again, is something that can create more inflammation in the throat. It can lead to bad breath as well. So those are really discussions again with someone where, the old way when I went through residency, it was just like, well, if people don't like their tonsil stones, you just tell them you can take those tonsils out. And I was like,
Yeah.
okay, but is there anything we can do before that? Like, is there anything else?
Yeah.
So there is, right? There is. We can work through, when I start to ask about the oral, hygiene and things like that, most people already brush their teeth, they already floss. Another big one is to not be using the alcohol-based mouthwashes because they will kill off the good bacteria with the bad bacteria. And
Mhm.
then you're really getting a kind of a dysbiotic environment. But yeah, we start there, we go through, these other potential contributors, and then we start to see what can we modify. And I have absolutely had people who come in thinking they're going to have to get their tonsils out. And by the end of working together for a few months, they're like, I mean, I might get one every once in a while, but these were people who were getting them on the daily.
That is so interesting. Because I'll get one exactly once in a while. Like I want to say maybe one every 6 months, or I don't know,
Mhm.
one a year even. It's very infrequent.
Mhm.
But my daughter used to get them quite often, when she was in college and teenager. And she even had this is, as a doctor, you're probably more mortified about. She took a hairpin and undid it, and then she tried to get it out with this hair. And I'm like, ugh.
Yeah.
Anyway, because you don't want it in there. But it seemed like her little hole back there was really large as well. So like it was
Mhm.
like easy for, but the gut microbiome is an interesting correlation to that. I didn't know that. And so that makes
Mhm.
total sense. And so working again on your gut health and eating a good diversity of plants and getting adequate fiber and all of those
Mhm.
things that if you just listen to my previous podcast, folks, with Dr. B, that's what we talked about is how to improve the
Mhm.
gut microbiome. But did you know how much it impacts what's going on in your mouth as well? I didn't. And that is really great advice. Thank you for that.
Mhm.
Yeah. Interesting. Well, anything else that you'd like to address for us peri and menopausal women that we haven't discussed that is right on your radar right now that you like, hey, if they knew this, this would be better for them.
Yeah, I mean, I think when you look back over your life or your child's life, you start to see the impact of hormones on your ENT health a little more clearly. Like one example I like to walk people through is we see a lot of increased nosebleeds during puberty in males and females, because obviously males have estrogen too. And people are always like, what is going on? Are they always going to have these nosebleeds? And I'll say, no, they're going to outgrow it. It's puberty. It's because estrogen is going to increase the vascular supply in the nose. And so they're just at increased risk right now. Then
Mhm.
you move on to, young adulthood and women are getting pregnant. And about 50% of women will, with one of their pregnancies, experience rhinitis pregnancy or rhinitis of pregnancy. And I don't know if you had that in any of
I
yours, but
didn't
it
have
is
that.
kind of
But I had
miserable.
the
It's like the
nosebleeds as a
final,
child. Yeah.
yes. And so in the final, usually it's the final trimester, but for about if women start to get really congested and have really struggle breathing through their nose, but then it's something that as soon as they get, have the baby and, give them a couple weeks to recover from that, it goes away. And so that's another example of how estrogen influenced the nasal cavity. And so for us to start focusing on menopause related symptoms isn't out of the blue. It makes complete sense. And
Totally.
I talk a whole lot about nasal health, nasal breathing, how important it is. And I think I see too many women, I think women tend to take care of themselves last, especially if they're mothers. And I have women come in who are, suffering for decades. And they're like, well, my kids are finally out of the house and my husband retired. And I guess I thought it was time for me to check this out. And I'm going, you could have come in decades ago. But it's okay. We're here. We can do
Yeah.
some things
Yeah.
now. So yeah. So I think, to talk about it, to seek help, to take a look is really important because not only do we want you to feel better, but again, as we start to do more research around this, for a signal to show up to be of interest to people, it has to be in a medical record because most of those big chart review type cohort kind of retrospective studies are going to be chart review based. So if we don't have a diagnosis code of rhinitis or tinnitus or LPR or burning mouth syndrome or tonsil stones, whatever it is, there's no signal to be seen. And so I encourage people to bring it up, especially if you're a woman who is in this perimenopausal space. And the hope is that the signal is more and more recognized. We can get more and more studies looking at not only treatments that we've already talked through, but also what is the impact of hormone replacement therapy if that's something someone wants to look into.
Mm-hmm. Do you use mouth tape?
I do not personally, but
Because
I'm
you're
not a
not
mouth breather.
right. You keep your mouth closed. Yeah.
But I have talked people through it. What I will say is with mouth tape, I would never recommend it without a good nasal exam because I've seen too many people come in with nasal blockages that are not fixable by just taping your mouth shut, and then you're putting yourself in a dangerous situation.
Right.
So if someone wants to try it, we're going to do a full nasal exam. We're going to make sure they actually have space to breathe. And then we're going to talk about whether or not the likelihood that retraining the mouth to stay closed will have any impact. I'm not going to say it doesn't have, it has some benefit for people. It is not a magic pill.
Yeah, for sure. For sure.
Yeah.
I think I heard
Yeah.
on Huberman years ago that it changes the shape of your jaw. And then people were doing it just to get a more pronounced jawline. Is there anything in there?
I mean,
Pops and buzzes.
probably not. Wishful thinking.
Yeah. And I mean, for
Yeah.
me, every treatment is all about how do I feel better, right? How do I get rid of a
Mhm.
symptom that could be bothersome? And yeah. So I learned a lot today. Thank you so much for your time. And I'm sure our audience has learned so much as well. Where can they find you, follow you, and or see you? Tell us, and I'll let everyone know in the show notes below as well.
Great. Well, first of all, this was so much fun. So thank you for having me. I can be found through the website. So I practice integrative ENT. And so the website is www.integrative.enthealth.com, all one word. You can also find me on Instagram. My handle is @ENTchat. And I'm able to do some types of virtual consultations. I'm doing more courses. I have a course called the Sinus Reset, which I absolutely think is amazing. And it is 10 years worth of this kind of reading and educating and putting it together in a digestible format for people who want to look at nutrition and nasal breathing and herbal remedies and things that are a little bit outside the box of your nasal spray that you might get prescribed. But yeah, so it's great. I have a lot of fun with it, and I would be more than happy to talk to anybody who wants to reach out.
Fabulous. I'll make sure that I put all of those, including that sinus reset course, in the show notes below. So check out the links. Don't forget to be subscribed to our channel here. We'd love to see you press that little plus button. If you're over on YouTube watching this today, make sure you're subscribed and turn on the bell to be notified when a new podcast comes out. Thank you so much for your time, and it was so amazing to meet you.
You too. Thank you so much.
Now, to all of you, go move daily in your fitness, your wellness, your nutrition, and we'll see you all in the next Move Daily Talks.